cases go up by 3,300. Across the country, there were 17,540 new coronavirus cases and 77 deaths. The number of positive cases in England has been rising for over a month, and the latest set of weekly data from NHS Test and Trace shows no sign of this upward trend halting. Here's everyone who's tested positive since the service began at the end of May. Between the 24th and 30th of September, 51,475 people in England tested positive. That's a 56% increase within a week. However, although this is significant, it's some way off doubling every week, let alone every 3 to 4 days, as was the case at the start of the pandemic. The test and trace system relies on finding people who have come into contact with an infected person. And you can see here that's starting to drop away. The top line is the amount of people in England transferred to test and trace, but the bottom line is those who are actually reached. But doing more tests means, naturally, more positive cases are going to be found. Now, as we come into the winter flu season, it's important to compare COVID-19 to other key seasonal respiratory illnesses. This shows how much more deadly coronavirus has been in men, women and all people alongside flu and pneumonia. It's important to note, however, that last year's flu peak was in December. That's sooner than most years, so we're still waiting to see the full impact on hospital admissions and deaths. A huge jump in daily infections, test and trace failing to reach more people, and the onset of winter are all significant factors on their own. But put all three together at the same time, and you begin to understand why tighter restrictions are almost inevitable.